Hey everybody, it's Dr. Kadisha, your board certified emergency medicine physician and author of the best-selling book, Help Us Help You in the Emergency Room. It's what an ER doctor would tell you if she only had the time. And I'm here again to tell you of something else that I wish we ER doctors had a chance to talk with you about more, because too often pancreatic cancer might be found in the emergency room. Let me just take a few minutes to see if folks come in. And let's see here. Let me just take a few minutes to share, let people know, send out the link before we get started. And once you join, do make yourself known in the comment section. Hit like and hit share. Thank you so much. I'm going to try not to make this too dry tonight. I'm going to try to make it, not so scientific, but informative, because pancreatic cancer can affect any of us, and it's the most deadly cancer in many cases because it's not detected until it's in the advanced stages. So let's just take a moment to share. And see who else comes in. We'll just give it another couple of minutes. And I also want to welcome folks who might be catching this on the replay. So if you do catch it on the replay, just type in the comments, say hello, and type in #replay, okay? All right, so we'll just get started. Hopefully folks will come in and catch the replay. Do hit share. Thank you. And so I just want to talk about like a brief overview of pancreatic cancer and the two major types. And I'm going to insert, just some a bit of insight possibly from Steve Jobs' journey with his fight with pancreatic cancer, and like a little bit from Aretha Franklin. And if you have any questions, about this information or want more information, do check out the National Cancer Hotline or Information Center listed here. And I'll try to list that throughout the discussion, or if someone can put this number in the chat, that would be great. So what is pancreatic cancer? First of all, cancer itself is uncontrolled cell growth, usually due to a mutation in the DNA of a cell, and it causes the cells to grow at a faster rate. Often the cells can live long after they're supposed to die, and because you have cells living longer than they should, you have an accumulation of cells called tumors. And these tumors can, they can invade other organs and also invade blood vessels, and that's how they might get to distant parts of the body and cause cancer there, also known as metastases. So in the tissues of the pancreas, these cells can grow, and the most common type of this cancer is the pancreatic ductal endocarcinoma, and I'll put that in the up here for you. And it's when the cancer forms in cells that line the ducts of the pancreas, and the ducts are the tiny tubes anywhere through which enzymes might leave a certain organ. So because this cancer involves cells that line the ducts, the little tubes through which enzymes leave an organ, they call it a pancreatic exocrine cancer. Exo meaning outside. Okay. The second, and that's the most common kind of cancer. The second kind is the pancreatic endocrine cancer, also known as the neuroendocrine tumors or the islet cell tumors. And these are called endocrine cancers because they are not involving any substances that leave the organ. These are related to hormone producing cells in the pancreas. So they call it endo versus exocrine. And Aretha Franklin and Steve Jobs had this kind of cancer. And it's actually pretty rare, maybe about 5 to 7% of pancreatic cancers. But it, unfortunately, even though it's rare, it has a better prognosis than the more common kind, which is the pancreatic exocrine cancer. Okay, so let's see here. So I'll just list that here. So that's number one. That's the most common kind, the ductal adenocarcinoma. And then the second kind, which is more rare, is this kind, the neuroendocrine cancer. Okay, so what makes this cancer so deadly again? And this is the take-home message with pancreatic cancer. What makes that it is often not found until it has reached the advanced stages. Had it been caught, in many people in the earlier stages, it could have been treated, and there would be many more survivors of this kind of cancer. So what kind of symptoms would you say cause pancreatic cancer, or are indicative of pancreatic cancer? That's the other thing. The symptoms are somewhat non-specific. Say like with Alex Trebek. Alex Trebek first complained of abdominal pain that wouldn't go away, and that's the number one symptom. And it's abdominal pain that radiates to the back, and that is characteristic of many disorders of the pancreas. You could have pancreatitis from drinking too much, and it's going to present with abdominal pain radiating to the back. And why? It's because the pancreas is behind the stomach. Okay, so another symptom is, so besides the abdominal pain, is loss of appetite, unintended weight loss. And Aretha Franklin, we did notice that she had, significant weight loss, yellowing of the skin and the whites of your eyes, also known as jaundice. And author James Baldwin, he actually had jaundice, and there are photos of him where you can clearly see that the whites of his eyes were yellowed, and he was diagnosed with pancreatic cancer as well. Another symptom is light-colored stools. Light-colored stools and dark-colored urine. Okay. Other symptoms include itchy skin, and that could be due to the deposit of, and caregiveraction.org, that's the website for folks who are caring for cancer patients. So many of you in the audience might already know about cancer, pancreatic cancer, different kinds of cancer, or someone who is close to you who was just diagnosed with cancer. If you need support, go to this website. Okay, awesome. So the itchy skin can be due to the deposition of bile salts from liver involvement. So the jaundice is often a sign of involvement of the liver because the liver makes bile, and the itchy skin can also be due to bile salts that make it into our skin. Another possible sign of pancreatic cancer is a new diagnosis of diabetes or existing diabetes that's becoming more and more difficult to control. So if someone is experiencing that and they're just like, why can't I get my diabetes under control? Especially if you're eating right, you're not sick, you haven't, gained a significant amount of weight, you're exercising, you're doing all the right things, there might be something more serious going on. So don't just blame yourself and blow that off. It might require more evaluation. Blood clots are another symptom of possible pancreatic cancer. Any cancer can put our bodies into a state. They call it a hypercoagulable state. Hyper meaning, extra, coagulable meaning coagulation or clotting of blood. So just about any cancer can make our body more prone to produce blood clots. And these blood clots, the significant ones, the ones that cause the most trouble, occur in the deep veins of our calves, and they can travel up to our lungs and become pulmonary emboli, meaning, clots that have traveled to the lungs from another source, typically the deep veins of the legs. So, and fatigue. I mean, what illness does not cause fatigue? So as you see, very non-specific symptoms: abdominal pain, weight loss, yellowing of the skin, and the eyes, the white of the eyes, itchiness of the skins. Yeah, that is more specific to liver involvement. But blood clots, fatigue, loss of appetite, unintended weight loss, a number of those things can cause, a number of conditions can cause such symptoms. And one reason why I, as an emergency physician, am especially touched by pancreatic cancer is because, unfortunately, patients just might ignore these symptoms for months and then finally come into the ER. And too often, that person is put on the road to diagnosis of pancreatic cancer by imaging that we might get for abdominal pain, weight loss, loss of appetite, yellowing of the skin. Those kinds of things might often lead us to get imaging of the abdomen. And we have to tell patients who were not expecting this at all that a mass was seen in your pancreas. And the radiologist, they write their report, they say, concerning for malignancy, further evaluation is advised, and that's all they have to do. But the ER doctor has to actually sit in front of the patient and tell them that they might have pancreatic cancer. So when should you see a doctor? Don't wait until you have to go to the emergency department for these symptoms. If the symptoms worry you at all, go see your doctor. Get a primary care doctor. If you don't have insurance, see what the healthcare system in your city or town provides. Often metropolitan cities, major metropolitan cities, even smaller cities, and some towns may have free clinics or clinics that provide affordable care so that you can at least get started. Do not suffer alone just because you don't have insurance or you don't have a relationship with a doctor. You can always start somewhere. And again, if these conditions are persistent, they're lasting months and months and months, you don't feel the need to go to the ER, but you still have these symptoms, do not sit on them. Get help, because while many other less serious conditions cause these symptoms, stress, depression, things like that, viral infections, food poisoning, things like that, while those conditions can cause these symptoms, so can one of the most serious conditions that face us as human beings, pancreatic cancer. So have your doctor check for, those less serious conditions. That's what they're going to do anyway, check for the more common, less serious conditions, but also having pancreatic cancer on their list of possibilities. So you're probably wondering, what causes this? What possibly could cause this. And it's not clear what causes it, but some factors have been identified to increase the risk of this kind of cancer, including smoking and having inherited certain genetic mutations. So there's a genetic component to it, but then there's also smoking as well. So, and in addition to smoking, though, diabetes can increase your risk. Chronic inflammation of the pancreas can increase the risk. And, the most common cause of inflammation of the pancreas, also known as pancreatitis, the itis means inflammation, can be excessive alcohol use. Also, other less common conditions or habits can cause pancreatitis, certain diuretics, imbalances of metabolism can cause pancreatitis, but the most common cause of pancreatitis, even trauma can cause pancreatitis, but the most common cause of pancreatitis is excessive alcohol intake. And as we enter the holiday season, we are expecting to see more of that in the emergency room. So smoking, diabetes, chronic pancreatitis, a family history of genetic syndromes, can cause that. Lynch syndrome, a familial atypical mole malignant melanoma, which is FAMMM syndrome, can cause it. A family history of pancreatic cancer can cause it. Obesity can increase one's risk for pancreatic cancer. And older age, unfortunately, as most people diagnosed with pancreatic cancer are diagnosed after age 65. But a large study did show that a combination of smoking, long-standing diabetes, and a poor diet does increase the risk of pancreatic cancer beyond the risk of any one of these factors that I mentioned alone. Okay, let me just see. I see some comments. Hey, Dr. Dietrich, thanks so much for joining me for this discussion. I really appreciate it. Please do hit share. I would really appreciate it because, again, as an emergency medicine physician, too many times I've had to, and it's not numerous times, I'm not going to say that, but any time is too many where, a person comes in, they don't have a doctor, they've had months of abdominal pain, which we typically see as well. If they've had it for months, it's really not an emergency, but we'll still get the CAT scan just out of concern for that person. And we have to look at this report from the radiologist saying that they see a pancreatic mass. And we are the ones too often, the ER doctors are too often the ones who have to first put in a person's mind that they might have cancer, and pancreatic cancer is the most deadly one. So as the pancreatic cancer progresses, it can cause, certain complications, weight loss, the jaundice I was telling you about, and pain that I couldn't imagine. A growing tumor can press on nerves in the abdomen, causing pain that can become severe. It can cause, sharp shooting pain, burning pain, a severe sensation of pressure. Pain medications, might help you feel more comfortable, but too often don't eliminate that kind of pain. That might be another reason, just like Alex Trebek, he had abdominal pain that wouldn't go away. And he was already experiencing complications of the cancer. So once you've left the emergency room, usually, and a good ER physician won't just say, follow up with your healthcare provider. A good ER physician will give you, names, addresses, phone numbers. We are presented with usually with lists of doctors who want to add to their practice, and they want us to send patients to them, and it's all specialties. So, it could be family practice, but gastroenterology, a gastroenterologist might be the first person outside of the ER to help you with any issues of the digestive tract, such as the pancreas. But really, and that's typically the first step. So, once you start to see a specialist outside of the ER, then, the goal is going to be ruling it in or ruling it out. So more imaging might be needed, so that there might be a repeat CAT scan, or, a CAT scan dedicated to the pancreas done, or there might be an abdominal MRI, which also shows the organs in detail as well. And so, you go through that, you're, and if they find something of interest, then there might be a biopsy. And sometimes interventional radiologists or surgeons, especially surgical oncologists, they might be involved in the diagnosis by way of, doing biopsies, doing an exploratory surgery to see what they find so that they can remove the tumor once they see it. So once the person is unfortunately diagnosed, certain treatment options are presented to be discussed, between the treatment team and the patient and their family. And that leads to the issue with Steve Jobs. When Steve Jobs was diagnosed with his pancreatic cancer in 2003, and again, he had the rare form of cancer. And it was different from the highly aggressive, often, rapidly fatal pancreatic adenocarcinoma. That's the most common kind. He wanted to weigh his options. There's the conventional treatment, which is, chemotherapy, radiation, surgery, things like that. But he chose to try less conventional treatments or alternative medical therapies. And, acupuncture, botanicals, dietary changes. And you can read about this more in his biography. And there are interviews out there with his friends and colleagues who corroborate this. But yeah, there's an author. The author of his biography talks about it many times. So he said that he chose those unconventional treatments, and because there was the factor of magical thinking. He said that he believed that if you ignore something that you don't want to exist, if you have that magical thinking, it might go away. And that magical thinking had worked for Steve Jobs in the past. But he did go on to regret delaying that surgery. He delayed his surgery for about 9 months. Despite pleas from family and friends, he put off the surgery initially. So, so that's one thing to consider. And, and I'm not, I practice conventional medicine, but I am well aware of alternative and complementary treatments out there. And I think the best thing would probably be a combination of the two. There's no saying that acupuncture can't help relieve pain, or that botanicals can't help relieve pain or, improve your mood, but you still have to consider, the track records of the conventional treatments, chemo, radiation, surgery, versus the alternative treatments. And, and on his behalf, I'll say, there was limited literature on, how well the conventional treatment would work for his neuroendocrine tumor, or the pancreatic endocrine cancer, but there was even less proof that these non-conventional complementary methods worked. So there was even less literature showing that acupuncture, diet, and botanicals was going to work than chemo, radiation, and surgery. So I just wanted to, let's see here, we have, and let me just refresh here. So yeah, if anyone else is here, definitely put any questions or comments that you have in the chat. And to move on, so you've got, we've talked about diagnosis, we've talked about treatment, we've talked about conventional versus alternative treatments. And even though the neuroendocrine tumors that Aretha Franklin and Steve Jobs had are less aggressive than the more common kind, the pancreatic ductal adenocarcinoma. Even though they're less aggressive, unfortunately, this disease is still hard to treat. It's still hard to treat. Even this less aggressive form of the cancer is hard to treat. So, Steve Jobs was diagnosed with pancreatic cancer in 2003, right? And he made it to 2011. He made it to 2011 fighting, valiantly against this cancer. Aretha Franklin lived a number of years with her cancer, and she had, toured and everything, and she kept in touch with her doctors. Her two doctors did interviews with the Associated Press, and while she said she wanted to live her life, she was still asking, how long is this treatment going to be? When could I go back on tour? When's a good time to do this? When's a good time to do that? Meaning, versus treatment versus things that she wanted to do. And she started her treatment in 2010 and continued to live her life, performing as best she could while getting treatment. So she started getting her treatment in 2010, and she lost her battle with pancreatic cancer in August of 2018. So she fought a long, valiant battle with pancreatic cancer as well. And actually, a year after her death, her estate, they backed a fund that will go towards research on that rare form of pancreatic cancer that she had. So, because her estate is funding pancreatic cancer research. Okay, so what are some things that we can do to prevent, or help lessen our risk for pancreatic cancer? Before, I talk about the take-home message. Number one, stop smoking. Stop smoking, stop smoking, stop smoking. If you smoke, try to stop. Talk to your doctor about strategies to help you stop, including support groups, medications, nicotine replacement therapy. And if you don't smoke, don't start. I'm surprised by a number of patients who've made it to middle age and they decide to start smoking. Don't do that. You're putting yourself at risk for a whole host of conditions that tend to creep up on us in middle age. It worsens hypertension. It increases one's risk for coronary artery disease, as well as lung cancer, stomach cancer. And now we know what pancreatic cancer. Stop smoking. That will help reduce your risk. Number two, maintain a healthy weight. If you are at a healthy weight, work to maintain it. Just because you're, as thin as a rail and you can eat whatever you want, with age, your metabolism stops working so much for you and it might work against you. So work to maintain it, maintain good cardiovascular health and fitness with exercise. If you need to lose weight, aim for a slow, steady weight loss, 1 to 2 pounds a week. Combine daily exercise with a diet rich in vegetables, fruit, and whole grains with smaller portions to help you lose weight. So prevention, number one, stop smoking. Number two, maintain a healthy weight. And three, which is kind of part of number two, is choose a healthy diet. Again, a diet full of colorful fruits and vegetables with whole grains may reduce your risk of not just pancreatic cancer, but cancer overall. And another thing to consider is meeting with a genetic counselor if you have a family history of pancreatic cancer. That genetic counselor can review your family health history and help determine whether or not you might benefit from a genetic test to understand your risk of pancreatic cancer and other cancers. Again, in the ER, I'm seeing that a number of patients, when I ask about their family history, they'll just say, "Oh, well, my mother passed, or my father passed," and they think that's it. But the question is, from what? At what age? You need to find out the cause, because their issues are your history. That's your family history, and your family history is your risk for various diseases. So do know that, know about your family. It's the holiday season. It's a pandemic, but people are still gathering regardless. So if you're going to gather regardless, ask your family members what kind of medical conditions they have, because the closer they are to you, the more immediate they are to you as a relative, the more concern there is for you being at risk for that very condition that they're complaining to you about, that you think that's just their thing, but it could be your risk for that particular thing. So just wanted to just give you this somewhat brief discussion of pancreatic cancer, because it can sneak up on a number of us. It's stuck up on Aretha Franklin, Steve Jobs, James Baldwin, Patrick Swayze, Ruth Bader Ginsburg. It took away people who were, legends, literal legends, people who were, larger than life, like Steve Jobs. And if pancreatic cancer can take these folks away with all their resources and their influence, we have to really think long and hard about what our risk factors are, what we're doing to increase our risk, and what things we can do to possibly reduce our risk of pancreatic cancer. So folks, do share this discussion, do hit like, do hit share, and think about what I'm telling you, as we go into the holiday season with, the temptation to eat certain things, the temptation to drink, which can lead to pancreatitis, the temptation to smoke due to family stress, and, the temptation to join family gatherings. Talk to those people, find out what conditions they're dealing with, and consider whether or not, you need to discuss those things with your doctor. I'm Dr. Kadisha. I'm your board certified emergency medicine physician. Find out more about me at drkadishamd.com. I have, I have a blog there. I have products there. You can get my book, Help Us Help You in the Emergency Room. I have great information from before you need the ER to after you leave the ER on ways to get through an ER visit that much faster, which could easily take time off of your ER stay and take money off of your ER bill. And join me here shortly in the future, in the near future, because I'm going to have some great specials and deals and a safety challenge that I will be bringing up over the next couple of weeks. We need to talk about holiday safety so that folks can avoid the holiday crowds in the ER. There's going to be crowds in the malls, but there's going to be crowds in the ER as well. So stay tuned, and I will see you next time. Bye-bye.